Good afternoon, and thank you very much to Mary and Karen for the invitation to speak today as well. My name is Mary Ferns, and I manage the Irish Cancer Society night nursing service. I suppose the Irish Cancer Society is incredibly proud and honoured to provide the night nursing service. We all know it's an invaluable service in the community, and I'm reminded every single day of the importance of the service. We work with an exceptional specialist palliative care teams in the community. We work very closely with them, and they are incredibly supportive also of our night nursing service, and we really couldn't provide the service without their support. In terms of my presentation today, I'll just give you a little bit of a brief background to our service, some of the statistics and costings, the challenges both for ourselves in providing the service, and also the challenges that are there for families from our structured feedback that we get from families. I'll give you a flavour of what some of the challenges are there for them, and also just a little bit about the role of the night nurse. So our service has been around for quite a while, going back to 1986. And I think at that time we provided that year about 80 nights of care, and we've gone up to now hitting for cancer patients almost 8,000 nights. And we also provide, through funding from the Irish Hospice Foundation, support for non-cancer patients as well in the community. We offer 10 nights of care per patient, and the night nurses go in from 11 p.m. to 7 a.m. Now, we do have a little bit of flexibility around that in terms of if the night nurses tend to ring the families maybe 2 hours before they leave, and they get an idea of how the patient is and how the family are. And if there is a distress there, they can go out a little bit earlier, so they can go out at 9 or 10 if they're able to. We can go up to 14 nights on an individual patient basis. The majority of our referrals come via the specialist palliative care team. 98% of our referrals come through the community specialist palliative care team, and we also take referrals from the teams in the hospital setting. For our cancer patients, we take referrals also from GPs and public health nurses. A very small amount of referrals come via that way. Our referrals for non-cancer or non-malignant patients, as I said, which is funded by the Irish Hospice Foundation, we only take referrals through the community specialist palliative care team. So the patients have to be under their care in order to receive night nursing. Some of our statistics then, so we have about 180 nurses who are located right around the country. In terms of the coordination of the services, myself as the manager, and we have 3 administrative staff. In 2018, 95% of our bookings requests were fulfilled, so we managed to secure a night nurse for 95% of the nights that were asked. A little bit behind this year, our service has grown this year, so we're at about 94%, I think, at the moment, 94% at the moment. 26% of our bookings are through our non-cancer or non-malignant patients. Just some of our statistics, I'm not sure if that's very clear, but I just did the first Q3 from January to September for 2017, 2018 and 2019, and you can see there has been a growth of about 6% in the cancer nights from 2018 to 2019. And with that, I suppose the yellow line indicates the number of no night nurses where we haven't been able to secure a night nurse for a particular night, and that also has grown fairly significantly, unfortunately, this year, because I suppose it's when your service is growing, it's difficult to catch up. For the non-cancer, that has had a significant growth from last year. It's up about 21%. So that's where our main growth area seems to be, is in the non-cancer area of our service. It costs about €350 per night to provide night nursing. We get about 5% funding from the state. So we, as an organisation, as a charity, we have to raise about €50,000 per week in order to provide night nursing. So it's a huge ask for the people of Ireland to donate to us, and we're really indebted to them for that. The €350 covers the night nurse's salary and their education training, and also the supportive services within the organisation, so the cost of administering the service and also the HR and financial cost associated with that. There are also recruitment costs. We have to, on average, we recruit about 30 to 40 nurses per year. It's a real challenge for us. We're finding there's a huge shortage of nurses. It's difficult, I suppose it's a challenging area for nurses to work in terms of the work isn't guaranteed. So there are nights where they put themselves available, but they don't necessarily get work. So you're always, I suppose, hoping that they won't leave because of that. We also do Garda vetting for the nurses, pre-employment medicals. We have an induction day and also do clinical placements. So there's obviously costs involved in that. Some of the challenges, as I mentioned, not having a night nurse is the biggest challenge for us. And that can happen where we have a surge in demand in the service in a particular area on a particular night, and we just simply do not have enough nurses to go around. Mentioned earlier about equity of access to palliative care, and we really find that in night nursing in the remote areas, particularly on the western seaboard. And Cork is a good example of that. Looking at the stats for 2019 so far, there were 33 nights in Cork where we couldn't provide cover, and out of those, 26 of those nights were in West Cork. And that's quite similar right across West Kerry, Connemara. Patients really do lose out in those areas because we simply find it very, very difficult to provide cover for them. As I said, recruitment of nurses is difficult because the work isn't guaranteed for them. We also find that during holiday periods and bank holiday weekends, we generally experience a shortage of nurses on those occasions because the night nurses, their working hours, they pick and choose themselves when they want to work. So obviously a lot of them will take time off to be with their children during holiday periods. Some of the challenges for families then, as Kathleen mentioned earlier, 70% of patients wish to die at home, and we know that 25% of them do so. I think families are absolutely, utterly incredible how they manage. I mean, there is this unbelievable expectation on them to look after somebody who's very sick at home, who is dying. And I think, you know, it's just a huge ask of them. And from our own feedback from families, we know that they will put themselves, both their mental health and their physical health, at risk to keep somebody at home, because that is they want to fulfil that last wish for the patient, is to allow them to be at home. And without that support from families, it doesn't matter what else exists. They are crucial in terms of allowing the patient to be at home, and I think we truly don't recognise that within families. The families also feed back to us that early morning, especially after the nurse has left, can be very difficult for them, and after 5 p.m. in the evening, families can struggle. We do provide twilight hours where we can. We not always successful in doing that, because the majority of our night nurses tend to want to work at night. But the feedback from the night nurses themselves, we would normally prioritise. So when we get a booking in for a twilight hour or for and also for an overnight cover, we would, I suppose, always try and prioritise the nighttime cover, because we feel that that's the most fearful time and the time when there's absolutely, you know, less availability of services. But the night nurses would definitely say to me that those twilight hours are incredibly invaluable as well, that particularly where a patient is maybe symptomatic or beginning to die, that it's really important, they have found, that to be there in that period also. We're the only nursing service providing end-of-life care to adults at night time. And in most cases, if there is no night nurse, unfortunately, there is no plan B. And my next two slides are probably the most important slides that I have, because it's the feedback from families who have had where there has been no plan B. And so what they said, both families had night nursing, had 2 nights, I think, and then unfortunately on the 3rd night they didn't have night nursing. One was at Christmas and one was over a bank holiday weekend. So what the first family said is, if it's If available, it's a wonderful service, but in its absence, there is nothing for a family to fall back on. We were unable to get a night nurse for Dad's last 2 nights and were left to fend for ourselves. It was a very distressing situation to be in, firstly to watch our poor Dad suffering in such a manner, feeling helpless and having to perform medical procedures with no medical experience. We felt very alone that night and hoped that we made Dad as comfortable as possible. And the other family said there were nights where we would cry watching him in such distress. I do think that his pain was under control, but the agitation, etc., was just awful to watch, especially for my mum. I don't feel able to start grieving as I'm so full of anger. I'm going to go for bereavement counselling and hopefully it will get rid of the anger. And I suppose acknowledging their pain, acknowledging their distress, acknowledging their anger just isn't enough. You know, I felt very helpless, and for both of those families, they both they were both very obviously very distressed, and I know I'm against the time here. So some of the other challenges I suppose that we have that we don't know what the unmet need is, and the national average uptake of nights per patient is 4, although we offer 10. So that's something I suppose that we do need to look into. There's an element of caution when introducing the service, the fear that nights will be exceeded. And patients are referred late to specialist palliative care, so hence why maybe sometimes the night nursing service is a bit late. Quickly, the role of the night nurse around pain and symptom management, administration of medication, giving reassurance, advice, friendship, understanding and psychological support. Providing empathy. One of the big things for the night nurses, they absolutely love their role. One of the big things for them is the time factor, and they have time to be empathic, they have time to be compassionate, time to show kindness and be caring, and they have the ability to walk in the shoes of those who are suffering and grieving. And their emotional presence obviously is very important, and as we know in palliative care, we only have one chance to get it right. For them, it's an honour and a privilege to provide, to work as a night nurse. They're often very humbled in their role. Personal growth is huge, and their appreciation for life. And my last slide is just in terms of, on a positive note, when the service is in place and how that impacts on a family. So this lady wrote, I now see that with having the night nurse present, my sister was comfortable, never left alone, free of all pain, and above all, she was not afraid to die. Thank you.